everybody, Dr. Rafich here from Vet Triage. We are continuing through the May 2022 edition of Veterinary Surgery, the effect of perfusate volume on amikacin concentrations after a saphenous intravenous regional limb perfusion in standing sedated horses. The study comes out of the University in Oklahoma. It's going to be a bit dry, this study, because they are comparing their results to other results, and so just a lot of verbiage and very niche. So, take it for what you will, but it does provide some insight on some basic pharmacokinetics when it comes to trying to achieve adequate concentrations of antimicrobials within joint spaces. The objective is to determine the influence of perfusate volume on synovial fluid amikacin concentrations in the joints of the hind limb after standing saphenous intravenous regional limb perfusion. 6 adult horses. The methods included 1 gram of amikacin diluted with 0.9% sodium chloride in volumes of 10 ml, 60 ml, 120 ml. Samples of synovial fluid from the tarsocrural, metatarsophalangeal, and hind limb distal interphalangeal joints were collected at 15 and 30 minutes after perfusate administration. Concentrations of 40 micrograms per milliliter and 60 micrograms per milliliter were considered therapeutic for susceptible and resistant pathogens, respectively. Results found there was no difference in synovial fluid amikacin concentrations detected between volumes in any joint. All synovial fluid amikacin concentrations were higher at 30 minutes compared to 15 minutes. All median synovial fluid amikacin concentrations at 30 minutes were over 40 micrograms per milliliter using the 60 mL and 120 mL volumes. Synovial fluid amikacin concentrations over 40 micrograms per milliliter were only reached in the hind limb distal interphalangeal joint when the 10 ml volume was used. All median synovial fluid amikacin concentrations observed were less than 160 micrograms per milliliter. Conclusions were that target concentrations for pathogens that were considered susceptible were consistently reached with volumes of 60 milliliters and 120 milliliters. However, median synovial fluid amikacin concentrations did not reach target levels for resistant pathogens. Clinical significance: perfusate volumes of 60 mL or 120 mL are recommended to treat infections due to susceptible pathogens in the joints of the distal hind limb. These results justify investigation of saphenous injections with different perfusate volumes using higher doses of amikacin. So that's the summary. So now we'll get into the introduction. Synovial sepsis can be treated with local delivery of antimicrobials. It's associated with improved clinical outcomes. Intravenous regional limb perfusion has proven to be a very cost-effective, minimally invasive, and safe technique that achieves higher concentrations of antibiotic and synovial structures of the distal limb without subjecting the patient to potential side effects seen with the regular recommended systemic doses that are also higher. Antimicrobial dose, peripheral vessel use, tourniquet type, number, duration of perfusion, the effective recumbency have all been studied. The impact of different perfusate volumes containing the same quantity of antimicrobial has been evaluated for cephalic and digital injections, but not for saphenous vein. The saphenous injections have been shown to result in similar antimicrobial concentrations in the synovial fluid of the fetlock as cephalic injections using a 100 milliliter perfusate volume, but some describe a volume of 60 milliliters as typical and more commonly used in clinical settings. Several studies have reported antimicrobial concentrations in the synovial fluid of the metatarsophalangeal joint and the tarsocrural joint after saphenous infusions. So that's the introduction there. Now, materials and methods. They used quarter horses, median age 15 years, median weight 535.5 kilograms. Regarding the intravenous regional limb perfusion, they were sedated with intravenous detomidine and butorphanol. They administered tibial and peroneal perineural anesthesia using 2% bupivacaine. Amikacin concentrations were measured using an enzyme immunoassay. And then for target concentrations for adult horses, the reported minimal inhibitory concentration of amikacin for common orthopedic pathogens, including E. coli, Staphylococcus aureus, Streptococcus equi, subspecies Zooepidicimus, subspecies equi, and Pseudomonas is 4 micrograms per milliliter or less for susceptible pathogens, and 16 micrograms per milliliter or more for resistant. Regional administration of aminoglycosides using 8 times the minimum inhibitory concentration as the target concentration is considered effective. Target concentrations of 40 micrograms per milliliter and 106 micrograms per milliliter were therefore established for susceptible and resistant pathogens, respectively. All right, results. The mean and range time for perfusion for Profusate administration was 1 minute and 38 seconds for the 10 ml volume, 5 minutes 6 seconds for the 60 ml volume, 9 minutes and 27 seconds for the 120 ml volume. For all the joints studied, the mean synovial amikacin concentration achieved at 15 minutes was higher than that at baseline using the same perfusate volume. Likewise, the mean synovial fluid amikacin concentrations achieved at 30 minutes were higher than those at baseline and 15 minutes. The median synovial fluid amikacin concentrations in all the joints studied were below the concentration considered therapeutic for susceptible pathogens at 40 micrograms per milliliter at 15 minutes for all volumes of perfusate, and were below the concentration at 30 minutes for 2 of the joints using a 10 ml volume. And the 2 joints were the metatarsophalangeal joint and the tarsocrural joint. The median synovial fluid amikacin concentrations in all joints were above the concentrations needed for therapeutic levels at 30 minutes for the 60 ml and 120 ml perfusate concentration at perfusate volumes. Only the hind limb distal interphalangeal joint was above this concentration at 30 minutes with the 10 ml volume. No median synovial fluid amikacin concentrations were above the concentration considered therapeutic for resistant pathogens at either 15 or 30 minutes in any joint. All right, discussion. I think with this discussion, what I'm going to do, I'm going to try and summarize it really brief because it's a lot of data, and it depends on the individual studies that are being cited here. So it may not mean much to a lot of people, but we'll see. And there's a lot of abbreviations, so bear with me as we go through it. So discussion. The results of the current study support the hypothesis that perfusate volume does not affect synovial fluid concentrations for amikacin achieved in those 3 joints. And that's the tarsocrural joint, the metatarsophalangeal joint, and the hind limb distal interphalangeal joint in standing horses. These results are consistent with another study which reported no significant difference in synovial fluid amikacin in the radiocarpal joint and the forelimb distal interphalangeal joint after cephalic perfusion, comparing 4 volumes, 10 ml, 30, 60, and 120 in standing horses. Another study found no significant difference in synovial fluid gentamicin concentrations in the metacarpal phalangeal joint after digital infusion, comparing 10 ml, 30 ml, 60 ml in standing horses. Another study found greater synovial fluid amikacin concentration in the metacarpal phalangeal joint after digital infusion using 60 mLs compared to 10 mLs in recumbent anesthetized horses. These results support the use of a tourniquet for longer than 15 minutes with 1 gram of amikacin, and consistent with another study that found the maximum amikacin in synovial fluid for the tarsocrural joint after saphenous injection with 2 grams of amikacin was 25 minutes. Another study found no difference in synovial fluid amikacin for the radiocarpal joint or the metacarpophalangeal joint with cephalic infusion with times of 10 and 30 minutes. Another study found the maximum synovial fluid amikacin concentration in the forelimb distal interphalangeal joint after cephalic infusion was 15 minutes, although the study utilized a total tourniquet time of 20 minutes instead of 30 minutes. Another study found higher concentration of amikacin in synovium with radiocarpal joint at 15 minutes compared to with 30 minutes, measured between 10 and 20 minutes. Another study found no significant difference in synovial fluid amikacin concentrations in either radiocarpal or forelimb distal interphalangeal joints at 15 and 30 minutes with 30 ml, 60 ml, and 120 ml per perfusate volumes. A higher synovial fluid amikacin concentration was seen in the forelimb of the distal interphalangeal joint at 30 minutes compared with 15 minutes using 10 ml volume. A larger volume has been advocated to increase intravascular pressure to provide higher drug effusion rate. In contrast, higher intravascular pressure may result in more profusate escaping into systemic circulation, or loss of venous integrity at the injection site, leading to extravascular profusate leakage. Additionally, in this study, the 120 ml volume was associated with local swelling, indicating leakage in 66% of horses. The median target concentration of 40 microgram per milliliter and 160 microgram per milliliter were considered therapeutic for susceptible and resistant pathogens, respectively, based on 10 times the recommended minimum inhibitory concentration for common equine orthopedic pathogens. The median synovial fluid amikacin concentrations in the tarsocrural joint observed in this study using 60 mLs was below another study at 15 minutes, and they found 29 micrograms per milliliter versus 190 micrograms per milliliter, and 30 minutes, which is 67 micrograms per milliliter versus a 404 microgram per milliliter. The median synovial fluid amikacin concentration in the metatarsophalangeal joint at 30 minutes with the 60 ml volume in this study, which is 52 microgram per milliliter concentration, was below another study finding 336 microgram per milliliter. The current study used a total 1 gram dose of amikacin, whereas in other studies they used 2 grams. That could explain the discrepancy there. Using 2 grams versus 3 grams of amikacin has been shown to result in higher synovial fluid concentration in the intercarpal joint with cephalic infusion. And another study found that 24-hour exposure at a concentration of approximately 800 micrograms per milliliter of amikacin results in the death of 50% of synoviocytes, and a concentration of 300 micrograms per milliliter resulting in death of 50% of chondrocytes, indicating amikacin has a dose-dependent cytotoxic effect on articular tissue. Prior studies have shown a rapid rise followed by a rapid decrease in synovial fluid concentration of amikacin in the first 24 hours after tourniquet release with cephalic, saphenous, and digital infusions. And so allow the cells to recover once it's out of the articular space. So finally, the median synovial fluid amikacin concentration was above the considered therapeutic levels for susceptible pathogens in these joints, tarsocrural, metatarsophalangeal, and hind limb distal interphalangeal joints at 30 minutes with 60 and 120 ml volumes. This was not observed in the 10 ml volumes in either the tarsocrural or the metatarsophalangeal joints. The concentrations considered therapeutic for resistant pathogens were not achieved with saphenous infusion using 1 gram of amikacin for any joint studied. So it's a good paper in terms of a continuation of other papers. This is obviously a popular topic. You want to have, of course, a larger number of horses, and there's lots of factors here. You know, the recumbency of the horse, the dosages, how long the tourniquet's on for, when do you measure the values, the effects of local and general anesthesia. All these things matter. So it's a complex study to undertake, but, you know, of course, hopeful for those folks who perform these infusions. So, all right, guys, we'll see you in the next video. Thanks so much.